Hi and welcome to the Wayne Lamos podcast. I'm your host Wayne Lamos, and we are on the final episode, Treatments for Anger for the Common Man, from the miniseries Understanding and Not Judging the Angry Young Man. Here we are briefly going to be looking at CBT, ACT, DBT, psychodynamic therapy, group therapy, play therapy, and lastly, a psychiatric medication mention. We start off with CBT, that is cognitive behavioral therapy, which is used to aid a person realize their behavior by tuning into their negative thoughts and then replace them with positive, realistic ones. CBT helps a person understand and identify their triggers and show them techniques and exercises best suited to them and their needs. Next, we move on to ACT therapy, that's ACT, acceptance and commitment therapy. Here, a person experiences thoughts and emotions and bodily sensations without attempting to control or judge or change them. If this step was not taken, it would lead to avoidant behaviors. ACT uses diffusion, where a person views their thoughts as simply thoughts, whether verbal or visual. Here we understand that cues, verbal mostly, become automatic. Diffusion allows for a wider range of behavior. Diffusion is used so that a person's thoughts do not cognitively fuse and get treated as their reality. A person is an observer and has mindful contact with the present moment, and now has choices and can use their own value system and not be bound by emotions and thoughts, etc., which surround them. Our next form of treatment for anger is DBT, dialectical behavioral therapy. This treatment has shown promising results in dealing with anger. It teaches emotion regulation, distress tolerance, mindfulness, and self-management skills, among others. Here, a person comes to terms with where they are, as well as act on improving themselves towards a positive change. Next, we have psychodynamic therapy, that's PSYDYNAMIC. Here, the focus is to reveal the unconscious content to release emotional strains that generate inner conflict and anxiety, also termed psychic tension. This form of treatment relies more heavily on a bond or interpersonal relationship between the person and their therapist. It helps give a person a deeper insight and understanding of their emotions and mental processes. Moving on, a common format used in anger management is group therapy. This form of psychotherapy uses the group process, where individuals work in groups in order to get things done. It can contain one or more mental health specialists conducting the group and about 15 people in a group. What is taught in a group is dependent on the group itself, and the program could differ and contain CBT, mindfulness, coping skills, and anger logs. We move on to play therapy, which is anger therapy for children. Here we recognize that children's brains are not yet developed and children may not be able to process their emotions. During play therapy, the therapist uses the playtime to gain insights into the child's problems by observation, after which the therapist can then help the child explore their emotions and resolve any unresolved trauma. Children who have undergone play therapy have shown stronger social skills, stronger family ties, and knowing how to better experience and express their emotions. Lastly, we have a brief look at psychiatric medications for anger. Note that these should only be given under a licensed professional and not self-medicated. Prescription drugs for anger are generally not anger-specific but antidepressants such as Zoloft, etc., which are SSRIs. SSRI standing for selective serotonin reuptake inhibitor. They increase extracellular levels of serotonin by limiting its reabsorption into the presynaptic cell. A quick mention over here, if you can tune into Series 1, Episode 3, Nutritional Mentions for Anxiety, you have a lot of mentions over there for nutritional boosters for serotonin also. And that's it for this final episode of Understanding and Not Judging the Angry Young Man on the Wayne Lamos podcast, recorded for community, recorded for you. I'm your host Wayne Lamos, thanking you for tuning in. Goodbye and see you soon in the next mini-series.